Are you aware that cyber adversaries target the healthcare sector the most of all critical infrastructure sectors? Hospitals and health systems in particular have frequently been the target of high impact ransomware attacks, which disrupt patient care and risk patient safety. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle, Executive Speechwriter with AHA. Join us to begin learning how to unravel the many complexities and nuances of cybersecurity concerns facing American hospitals, including gaining a better understanding of common offerings, what these services entail, and best practices when selecting a cybersecurity solution to protect your hospital and patients. Today's podcast is brought to you by Critical Insight, an American Hospital Association preferred security provider.
Hello, everyone. This is John Rigi from the American Hospital Association, your senior advisor for cybersecurity and risk. Thanks for joining us today in our continuing Cyber and Risk podcast series featuring nationally recognized and accomplished cybersecurity leaders from healthcare, cybersecurity field, and government. Today, we are fortunate to have a combination of expert leaders from healthcare and the cybersecurity community. They'll provide us with their perspective and inside story on cyber and risk issues faced by healthcare and what you can do to help reduce that risk. So very pleased and privileged to have with me today my friends and colleagues, John Delano, Regional Chief Information Officer with the Advent Health System, and Mike Hamilton, Chief Information Security Officer for Critical Insights, to discuss cyber threats facing the field and the solutions available to help hospitals and health systems protect themselves and their patients. First, a little bit about our guest. Mike Hamilton has worked in information security for over 30 years in every sector and in every imaginable role as a practitioner, consultant, executive, and entrepreneur. As former Chief Information Security Officer for the City of Seattle, Mike managed information security policy, strategy, and operations for 30 government agencies. Prior, Mike was the managing consultant for VeriSign Global Security Consulting, and in that role, provided expertise for hundreds of organizations from Fortune 100 to small private colleges and in nearly every sector. Mike just recently was named Chief Information Security Officer of the Year at the RSA Global Conference by Cyber Defense Magazine. John Delano is the Chief Information Officer for Southwest Region of Adventist Information Technology. His responsibilities include overseeing information systems across the 4 hospitals in the region, integrating computer systems across providers and health systems, and directing the technology of major capital projects. John has more than 18 years of experience in healthcare information technology and holds a Master's of Science in Technology and Management from Oklahoma State University. Gentlemen, thanks for joining me today. And John, let me start with you. And Mike, feel free to chime in whenever you'd like. And
Sounds
John,
good.
Thanks, Mike.
John.
John, knowing cyber attacks are truly an enterprise risk to hospitals, could you start off walking us through some of the key cyber threats facing hospitals and the potential ramification of these attacks that can have on the organization and, most importantly, the patients?
Sure, John. As we know today that the attacks are getting more sophisticated, we've gone from trying to protect ourselves from script kiddies to now facing nation state actors and more sophisticated attacks. And healthcare typically operates on small margins with not enough money to spend on things like cybersecurity. In addition, we deal with a multitude of legacy applications. We deal with lots of biomed solutions that still run legacy technology. These devices have moved from standalone networks to being part of our production networks so that we can gather data on the patient, which inherently increases our risk. Certainly the aim of ransomware today is to create disruption and pain so that organizations will pay the ransom. And as we've moved from paper charts to a fully electronic record, certainly that disrupts patient care and can ultimately lead to patient safety issues.
Yeah, indeed. And unfortunately, we have seen a pretty dramatic increase in the frequency and severity of attacks targeting healthcare in all critical infrastructure sectors, right? Whether it's pipeline or the meat industry. It's amazing. Mike, maybe I could turn to you for a minute. So hospitals are one of the most common target for cyber adversaries. And again, we've seen a dramatic increase of these attacks. Based on your perspective, how are cyber adversaries attacking it, and how are you seeing hospitals respond, and just as importantly, increase their resiliency against these attacks?
Yeah, great question. And let me add a little to what John said, because one of the key points there, this notion of nation state collusion with organized crime has set up a situation that is far from a fair fight. And I think that is one of the really key threats that are looking at the health sector right now, because the health sector, along with others, and you brought up the JBS meat plant, the global organization of meat processing. Uh, you know, th- I don't think it's a coincidence that these extremely critical sectors are being, the object of focus of these actors. Some of the things that have been happening recently really start to look more like we're being poked in the economy, rather than these are just criminals, trying to extort. But hospitals as one of the most common targets, because they are so critical, they can't stand downtime, um, and they're given the logic used by the criminal mindset, they're more likely to pay. But your question is good about how are we seeing hospitals respond and increase their resilience. My observation is that the conversation has gone from keep the bad guys out of the network to manage the risk of a foreseeable event. I think we can all agree that 100% keeping the bad guys out of the network is not really a reasonable point of view. It's better to manage risk. So um, I think everyone is getting better at putting out little fires before the house becomes engulfed in flames. And this is borne out by new data showing that the time to detection for a compromised asset in your network has dropped from 200 days to more like 2 weeks, which is still a long time. And what that indicates is there's more of a focus on the impact term of the risk expression, right? There's the likelihood that something bad is going to happen, and there's the impact of that thing happening. Manage the likelihood with preventive controls, and everybody's got those. Manage the impact by detection and effective response. And I think there's a shift underway where putting out that little fire is starting to be an extremely important part of how cybersecurity is managed in the health sector, if that makes sense.
It does. And Mike, of course, you hit on a key topic, which I've been a strong vocal proponent and advocate of the issue of that nation states are at a minimum providing safe harbor for the
Yes.
cyber criminals and ransomware gangs to attack the U.S. And as many of you may know, as a former FBI agent from almost 30 years and running national cyber programs for FBI, the stark reality is that many of these gangs and criminals are beyond the reach of the FBI and U.S. law enforcement, being provided safe harbor in these adversarial nation states. Russia, primarily, China, Iran, North Korea, and others. So relying on individual hospitals sometimes, as you said, it's not a fair fight to defend against these very sophisticated actors. And as you know, I've always called for a whole of government approach. Defense is only half the solution, and then call for some potentially defend forward or offensive cyber operations. John, same question, your perspective And based on what we've said, would love to hear your thoughts as well.
Sure. And I would say to echo, certainly most healthcare organizations are not prepared to. I believe the term you use, an uneven fight, and certainly we have to balance the cost of security with the challenge of being able to provide patient care in a layered security approach and not disrupting that patient care. And so we certainly could restrict and make things more difficult, but in real-time patient care, that becomes restrictive. And so we have to balance that. And we have to educate our organizations on some of these layered technology approaches that provide benefit to the organization, like two-factor authentication. Had a number of conversations with physicians over the years about the fact that we use two-factor authentication in our everyday life and we accept it. So pushing back on that in the healthcare setting doesn't make a lot of sense. And example there being, banking. When you go to the ATM, you use a combination of two-factor authentication to withdraw money out of your account. And I think most of us would agree that you would not argue against using two-factor authentication to remove money out of your account because we want to protect that asset. And very similar approach in healthcare, where we layer on those tools that help us provide or protect our patient data.
Yeah, good points there, John. There's this constant tension, if you will, within healthcare between the need for security, but the primary goal and priority of providing patient care. So, is our cybersecurity controls effective if it slows down the response, especially in an emergency situation, to provide patient care, and having the clinical staff understand the need for cybersecurity as they, of course, face their priorities of providing care. So,
Yeah. Can I jump in here for a sec?
Sure.
Because I think there's the other side of this too that rears its head every once in a while. Yes, an abundance of controls can slow things down, make it harder to access records and things like this. The other side of that is if you don't do all those things and you get smacked, the potential impact there is actually loss of life. And we all know the story in Germany where it's actually happened. It was documented at least once. I understand Scripps Health is having to, redirect patients. They're back online now, but for a long time, and there are potential ramifications there. So, I mean, you got to weigh that too. Yes, the business has to win, but when you're trying to manage an impact that's as severe as potential loss of life, yeah, we're going to have to learn to live with controls, doctors.
Yeah, agreed. And it's that balance again. And, as we always say, and I've said publicly quite a bit, a ransomware attack on a hospital, that crosses the line from an economic crime to a threat to life crime for those same reasons that you're pointing out, Mike. And I think the medical literature demonstrates that any delay in the provision of care, especially urgent care, at a minimum, increases the risk of a negative outcome. So regardless of whether we, can show specific harm to a patient, I think it's irrelevant. We know the risk increases whenever there is a delay in treatment. So if a ransomware results in any organization having to divert ambulances, delay care, to having to cancel surgeries or not being able to provide lab results, you can infer that the risk for a negative outcome increases dramatically. And I think that's what we're struggling with. That sometimes that the government and communities don't realize the potential risks when you attack a hospital. But let me go ahead. Was there any other comment, Mike or
I,
John?
I just want to say I think that mindset is changing. I think the healthcare is a critical sector, just like dams, water, finance, energy, all of those others. And the critical sectors were identified to specifically focus on them to prevent acts of terrorism. And taking down a hospital? Why are we not using the T word there? So I do think this mindset is changing, and I think there's going to be some public policy to help things very, very soon.
Yeah, I would hope so that, we can have a philosophical discussion whether if you attack critical infrastructure and that results in widespread public health and safety risk issue, does that equate to cyber terrorism, right? And causes widespread fear. Technical definitions, not having a state sponsor or some foreign nexus to the criminal definition of terrorism. Obviously, that would have to be a factor. But, again, for academic and philosophical discussion, is it cyber terrorism if a adversarial nation state harbors and perhaps assists criminal ransomware gangs to conduct cyber attacks, ransomware attacks on our critical infrastructure?
Well,
Which
as you know, I vote yes.
exactly. Well, when we get you up there on the hill, maybe we can push that even further. But yeah, tremendous issues to discuss, and I think the government and private sector are realizing the widespread impact of these attacks and the risk. Again, the risk to public health and safety. Let's just move on here a little bit. So let me go back, John, for a moment. With the complexities and serious implication cyber attacks can have, as we just discussed, how can hospitals prepare and begin to mitigate potential risks? Now, again, we never say eliminate, right? Because that's impossible, even as we've seen government agencies become victim of attacks. So again, prepare and begin to mitigate potential risks, and what kind of resources and solutions are available to help them mitigate that risk?
Sure. Thank you, John. I think that's a multifaceted answer there. And certainly there are things that hospitals can do, and in a lot of cases can do without cost. So, certainly practicing good cyber hygiene is extremely important. And, some of those things like being current on patches, which is difficult to do in a 24/7, 365 environment, because a lot of times applying patches requires systems to be offline for a period of time. And certainly that becomes difficult and challenging. But as we're seeing a move closer to 0-day threats, it becomes drastically important to make sure that your systems are as patched as they can. And in a lot of cases we've seen that attackers are still exploiting vulnerabilities that there were patches for 6 months, 12 months, 18 months ago. And so we have to get better at that. But I also think that we need some help from our partners, from our vendors. And certainly I mentioned that we run a lot of legacy applications. A lot of the biomed equipment is still using outdated technology, and our vendors tend to hide behind the FDA and the 501(k) certifications as a reason not to update their technology. And I think that there needs to be some pressure on vendors to step to the plate to start baking security into their technology and their solutions, and not just let it all fall on the healthcare organization to have to try to mitigate those threats.
John, can I just pull on a thread there that you mentioned earlier, just a moment ago? You're saying that vendors are saying using the excuse of FDA regulation, perhaps, or prohibition to upgrade or include cybersecurity in their devices, which to me I find astonishing, since my understanding is FDA, certainly that's one of the areas where you can patch fairly quickly for cybersecurity, is indicating their pre and post market guidance. Just wondering if you had any other thoughts, and Mike as well, feel free to chime in.
And John, you're certainly tugging at a thread that's near and dear to me too, because the FDA has come out and said that vendors can patch their equipment or update their software without having to go back through the certification process. But a lot of these vendors choose not to do that, and would rather say it's too difficult and too costly for me to go back through the FDA certification process, so therefore I'm not going to. And I won't name any names, but I dealt with a vendor where we identified a cross-site scripting error in the technology, which would allow unlimited access to the device. And we reported that. And rather than the vendor working with us to resolve that, I was threatened with a lawsuit.
Wow.
Disheartening. Mike?
Oh, yeah. So, number one, that was a really interesting story. Uh, there are some resources available if we can kind of characterize, I don't know, cyber maturity of an organization, depending on what access a health sector organization has to qualified practitioners. This issue about watching the network, looking for aberrational activity, and to John's point, the not only the legacy technology that has to stay in place, but all of the new technology that's been deployed for telehealth and remote work and all of these things just blew up that attack surface. So yes, you can go bolt security on everywhere, and everyone should do that, and you should keep your stuff patched, but realize something's going to happen. This is a foreseeable event, and so you got to watch the network, and you got to put out the little fire before the house is engulfed in flames. There are managed services that can fill that gap in, especially places like rural health, where they have no access to security folks. So, the various kinds of managed services, the one that VeriSign used to operate as an MSSP, managed security service provider. And, they put a device on your network and it hoovers up lots of stuff and it sends it over. And if something's going on, they tell you. Then the next generation of that is managed detection and response, MDR, and that's what CI security does. Um, then we put the device on the network and it hoovers up all the stuff. And if something's going on, we work with you to put out that little fire, plus or minus taking an action ourselves, at maybe 3 o'clock in the morning and you may be skiing or something like that. Another one is called Managed SIEM, SIEM, Security Information and Event Management. That is just having the device on your network that gobbles up all the logs and correlates things and having someone manage that for you. There's another variant called SOC as a service, which is pretty similar. There's also the automation option, SOAR, security orchestration, automation, and response. But it's not really there yet. You really need to throw human resources at that to get it to work. But it's got a lot of potential. So I think there are resources available to the health sector that are independent of doing everything yourself and thinking that you need to run a complete security program yourself. I'll say too, and John, you and I have chatted about this. I would like to see a bigger role for interns in the health sector, especially in rural health, where all these kids are going to school to get a university degree, and maybe between their junior and senior year they can spend time looking at logs for rural health. I'd like to see more of that. There's also something called the American Apprenticeship Initiative, that actually may show some promise in the health sector as well. So I think there are a number of resources, with varying levels of cost and with varying levels of applicability to the maturity of your own organization.
Yeah, totally agreed, Mike. And I know we've had many a discussion about how cyber threats facing the nation are absolutely a national strategic threat.
Absolutely.
And we absolutely need to respond as such. Not only whole of government approach, which we hear that often. I always say whole of nation. So using the interns, absolutely a fantastic idea. And I think that the latest stats I saw, just in the U.S., there are 359,000 cybersecurity positions open, unfilled, 0% unemployment rate.
Wow.
So we need to come together here. And then monitoring the logs, right? Key issue. You need to detect that the bad guys are in your system. It's going to happen, as you said. And I've spoken to some smaller organizations, unfortunately, where the IT director is wearing multiple hats, one of them being security. And just recently, I was told that the IT director said, "Well, we look at the logs every Monday morning, and we just monitor them 9 to 5, Monday through Friday." And they admitted they never catch up; they're always behind. tremendous vulnerabilities.
Yeah.
Yeah, tremendous issues that we've been discussing. And before we close out, John, let me turn back to you for any final thought, and then Mike, I'll jump back to you.
I think, certainly the challenges will continue to come, and we have to partner with the business. We have to partner with our vendors to create the best security posture that we can. I think traditional security is going to have to change. We're going to have to rethink as the onslaught of medical IoT devices come down the pipe, and we have to deal with data moving from the traditional four walls of a data center out to the edge device. We're going to have to get better at how we do security and how we think about security, and partnering with the business to make sure that we can layer on that security again without creating any kind of challenges to patient care.
Okay, thanks, John. Mike?
I'll just say that I'm hoping that public policy will come in to help the situation, because again, this is not a fair fight.
Totally agreed. And with that, I want to thank John and Mike for joining us today and sharing ways to protect the field, patients from cyber threats. And thanks to all our healthcare listeners for what you do and have done during the pandemic to care for our patients and our communities. This has been John Rigi, your Senior Advisor for Cybersecurity and Risk.
If you'd like to learn more about Critical Insight, please visit www.criticalinsight.com. In support of its mission to advance and protect health in America and provide exceptional value for our members, the AHA has created a panel of a limited number of highly reputable and qualified cybersecurity service providers to support AHA member hospitals and health systems with their cyber defense programs. The AHA Preferred Cybersecurity Provider Program, or APCP, will assist AHA members by directing them to firms that provide exceptional value in terms of pricing and quality for cybersecurity services. If you'd like to learn more about the AHA Preferred Cybersecurity Provider Program, please visit www.aha.org/center/security and risk advisory services/preferred-cybersecurity.